When cystoscopy and transrectal ultrasound are done on the same day, do you suffer the multiple procedure fee reduction? That is the question we are going to answer today. Hello, my name is John Lin, your humble host of the Thriving Urology Practice Facebook group, where our only goal is to help everyone succeed in your urologic practices. Now, I have had the honor and the privilege of being a center of excellence for UroLift, NeoTract, and one of the questions someone raised recently was during my workup of the UroLift patient. I usually see the patient in an office setting, and then in anticipation of the procedure, I will set up the patient for cystoscopy and transrectal ultrasound done on the same day. And the question was asked, well, don't you get a multiple procedure fee reduction when you perform the cystoscopy and the transrectal ultrasound on the same day? Well, in the past, in the remote past, maybe that was true briefly, but in 2019, that is definitely not the case. To figure this out, I went on the AUA, the Coding Today website. It's called AUAcodingtoday.com, and it's put together actually in collaboration between the Painters PRS network and also the AUA. I logged into the AUA Coding today, and I punched in 52000 under the CPT section. If you look at 52000, the descriptor is cystourethropy. And if you look on the bottom, multiple procedure reduction, it does apply when you perform cystoscopy. However, when you look at transrectal ultrasound, CPT code 76872, transrectal ultrasound is the descriptor. If you look on the bottom, multiple procedure reduction rules do not apply. Now, what the heck is going on? Okay, one says does apply, the other says does not apply. How does this work? Now, take a look at 76872. If you look at global, it says XXX. Global does not apply. That is the primary indicator to tell us that there is no multiple procedure reduction. Keep in mind, the transrectal ultrasound is actually a radiologic code, and 52000 cystoscopy is a surgical code. So no, the bottom line is there is no multiple procedure reduction, meaning you perform cystoscopy the same day as transrectal ultrasound, and you should be paid rightfully, fully for the performance of these two different procedures. One is a surgical code and the other is a radiologic code. All right, now if you are ever in doubt, you can always throw the codes in the AUA Coding Today bundling matrix, and I'm going to show you right now. I put in 52000 and 76872 into the bundling matrix, which is a feature in the AUAcodingtoday.com. And if you look at follow the arrow, it says OK to bill and no modifiers are necessary. It is, for coders and billers, it's truly an invaluable tool. The bundling matrix, I'm sure you guys probably who code a lot of surgeries probably live in the bundling matrix when your doctors are throwing different procedures that they're doing on the same day. So if you are not a subscriber of the AUAcodingtoday.com, you should consider having your practice subscribe. It is invaluable. I mean, just look at the CPT descriptors. You get the layman's description. You get the CPT description, as well as the RVUs specific to your region and compared to other regions if you wish. Bundling matrix, super, super powerful and valuable so that you are not leaving money on the table. So the bottom line is cystoscopy and transrectal ultrasound, when you do them together on the same day, both are payable in full. You do not take a multiple procedure reduction. Of course, I had to verify, and I consulted Mark Painter just to make sure what I'm telling you is correct and is true. And Mark works with PRS Network, so thanks to him, kudos and gratitude as usual. If you want to go into a deeper dive into any of these types of topics, feel free to sign up for the Urology Advanced Coding and Reimbursement Seminar that is held annually, at least annually. And this year, I think in 2018, 2019, one was held in December of 2018, and we are doing another one in February of 2019 in Orlando, Florida. Feel free to sign up for these courses. We deep dive into topics like these and then many other topics, even though there's a lot of attendees and asking, they all have the same questions, and you may not remember. So if you plan to attend, make sure you write down all the questions that you have and ask them at those meetings. And if you have something pressing that you just have to get off your chest, I encourage you to leave a comment, make a post, either a video like what I'm doing, or just simply write it out, or create a meme if you want. Anyway, ask away. This is how we can help each other become more successful in our urology practices. I bet you do. No matter who you're rooting for this weekend, it is Super Bowl weekend. May the best team win. Have a great weekend. Take care.